All right, folks, how's it going? I don't like bringing these stories out in the beginning of the year. I had to put out, this is my second story that's not good for the beginning of the year. It's January 2nd, but I think this is stuff that you have to learn, or you have to, I don't know, to see the transparency of it for you ladies to be more mindful. Okay, the ladies that are thinking about this, doing this type of procedure of these doggone BBLs. And I made a couple of videos about this before, particularly like 9 months ago, where as a result, there's no wheelchairs in the airport, okay, and down there in Florida, in Miami and Tampa, all right, but these doggone BBLs. So we're going to talk about, her name was Secreta Tolliver, okay, 36-year-old young mother of four beautiful daughters, okay? And she was a very beautiful sister herself, all right? Businesswoman. Looks like she had a lot going for her and her whole life going for her, all right? Cut short. For what reason? For clout? A lot of this stuff is for clout, okay? And as a result of this many of these doggone women that they're alone anyway, all right? And they do this stuff for clout, and they may, show it off a little bit, and they still don't get all of the clout that they want, okay? And let me tell you something else, guys, all right? You too. Because, these doggone penis surgeries, to try to put them implants on there, you need to be very careful, okay? But back to uh, um, Secreta Tolliver, rest in peace. My condolences go out to her family. So she left December 12th, Chicago, to fly to the DR to get surgery. And 2 days later, all right, my understanding that she had officially passed away. Now, she did contact her family or her oldest daughter, saying that she was in a lot of pain and so forth. And right now, as we speak, the brother, okay, is fighting to try to get her body back, okay, to try to investigate through the U.S. Embassy, you know. But the thing is, well, let me say this. As a businesswoman, I'm thinking she can't get that surgery, from a more accredited person, here in America. Number one, to go down there and put your life, or another country, Brazil or whatever, or Mexico, and put your life in danger over what, trying to save what, 50, 60%. You got to fly out there anyway and go get a hotel room anyway. Uh, so that's what's going on right now, okay? All this turmoil for investigations, and they can put on that death certificate whatever they want, okay? Get the body back, all right? But it's one of the things you really couldn't do, really can't do, but so much other than do your own investigation once she gets her body back. And maybe use this for a learning tool to teach others about the dangers of this type of surgery, okay? And no matter how accredited the doctor is, it's always a risk, okay? Anytime they cut you open, it's always a risk, okay? Now, there's reports of maybe perhaps too much anesthesia, all right? Because a lot of the doctors, okay, don't know what they're doing as far as anesthesia, okay? Because that's a totally different procedure, and that has to be done by a totally, different doctor, unless the doctor is, has an identifier with the anesthesia, okay? And I've seen other stories about there's too much anesthesia has been administered, or things like succinylcholine, okay, that opens up your let's see here, your larynx, okay, in tubes or whatever, all right, to for surgery, that type of those type of properties, and then they end up dying, okay. While I got you here, I'm gonna get my keys from this cat. Hey, give me a sec. Give me about a minute or two, okay?
No, yeah, you're fine.
All right. Yeah, I was getting my car washed, but I seen, just did a little bit of research specifically on these BBL surgeries, okay? I told you that they're not safe. But some doctors were saying that the best procedure is like the body fat transfer, and the doctors can put anywhere between 1 to 5 pounds, in your backside, depending on how, I guess, the experience or how comfortable he is of putting, let's say a larger amount of fat, okay? Ladies, you really don't need it. Maybe I can see just a little baby behind with the body fat, but that is the safest one that you could do, okay? They're usually permanent, but your butt can, if you're not working out, okay, can kind of droop after about maybe 10 years. So you need to be working out, okay? And it depends on, the shape of that can change depending on how much weight you gain or lose, okay? So if you're going to do that, you need to get an accredited doctor. I'm telling a highly one. Just spend the extra money, and that's the best option, okay? Or you can get the implants, okay, which you really don't need, okay? They have certain circumstances where maybe women, they get muscles cut out of their behind, all right, that type of stuff, or like the breasts and all that, okay? Like I knew a lady that had breast cancer, and she had to get the breast done because of that, all right? Um, so it was one of those special circumstances, but you really don't need it, okay? Because what it does is with that silicone and stuff, your body forms around that stuff, and that silicone is not safe. Okay, it could leak, it could seep out, the seal could break. Okay, next thing you know, it gets in your bloodstream and you can get poisoned. Okay, but you don't know what that stuff they putting in you. Okay, I've seen a procedure where they put doggone fixer flat in a woman's butt. Okay, you know, all type of stuff. Like I don't know, rubbers, a rubber type of I can't think of the name, like a property, like a rubber type. All right, I don't recommend it. Okay, for you to put your life at line over clout. Cardi B had recently had her butt implants removed. It's a few others that are finally coming to a light. I believe K. Michelle and some others are saying, look, it's not worth it. It's going to give you complications once you probably, get in your 30s. And when you have things like diabetes, high blood pressure, those conditions, they come up anyway. All right, ladies. All right, breast cancer. All right. So we already have enough of these preconditions. So why would you want to add on to something that you really don't, you end up dying over something you don't really need, okay? So please, use discernment. All right. If you're going to do it, you're going to do whatever you want to do, but use the best discernment. I tried to tell you. And another thing, you can get a naturally nice butt if you do certain exercise. Yeah, I'm coming right now. I'll do it myself. Okay. All right. All right. I'm going to do it right now. Okay. Okay. Hey, there's some exercises that you can do, ladies and gentlemen. I mean, sorry, ladies. Okay, with the fireman exercise, you just get on all fours on your elbows, and you can just do like 5 sets times 5. Okay, outwards and then sideways. Okay, you do that 2 or 3 times a week, and your gluteus, what they call the gluteus muscles in the backside, they're gonna tighten up anyway. Okay, so there's some natural ways that you can, get yourself a nice toned backside. Okay, everybody can't be like, y'all remember Strawberry, right? On the 2 Live Crew, everybody can't be like that girl or like the Kardashians. All right, y'all cut that out and let me know what you think about the video. I got to get out of here. All right, peace. Rest in peace to that lady, my regret squad, to her family.